I was in the crime lab, but I didn't deal with people. I just dealt with, the cases and stuff like that. But when I first got out, I had no idea of substance use disorder. I just thought people had made bad decisions, and they had to be responsible for the decisions, and this is just the luck of the draw. Now, I absolutely don't believe that. I believe that sometimes people are in a situation and they use something, especially if it's heroin or whatever, or even oxy, and once they've done it that first time and they have that propensity to be addiction in their brain, then all bets are off. So now I'm a lot more sympathetic to the plight of everybody that has this, brain condition. I don't call it a disease because a disease has to be medical. This is a disorder of addiction. But really, I'm tucking it in with behavioral health, because if you don't like your life and you don't like what's around you, you are almost setting yourself up to when you're at a party and you want to I just want to get blasted tonight. And so, but I'm fine with realizing that it isn't people's fault. Okay, so the needle exchange program, and does it work, or does it cause a health hazard or biohazard, something? So I'm familiar with Stephanie and the Hope Dealers. Every Sunday they go out and pick up needles. I think last Sunday they picked up almost 2,000 needles. That's a ton of freaking needles. Now, on the plus side, I know this is not being sarcastic, but most of the needles do have the caps on them, but they're still being thrown on the street. Now, they have made some progress on Clinton Avenue. They put a needle box up on one of the telephone poles, and some people are starting to use it, but they're not using it very much because there were 2,000 needles picked up last Sunday, which is insane. So, you're right, needle exchange is really not needle exchange. Needle exchange used to be, you get the old needles, you get the new needles, and now you just get a bag of 10 needles or whatever, and you just take them and whatever. They've said over and over, though, that the decrease in AIDS and Hep C and everything else from the needle exchange is worth the risk. I'm still having a real hard time with accountability. And I know when you're in the middle of shooting up heroin that you pretty much don't care about anything. But a little bit of caring about throwing these, it's not like 10 needles. 2,000 needles on a weekend on syringes that are possibly having some type of communicable disease in them, and kids walking around, just is like Escape from New York, almost like the movie. It's like, I can't believe that this is occurring at that level. So I think needle exchange is really good because it keeps the diseases down. But do we need to put garbage cans on pretty much every street corner? Maybe we do. And maybe you do some tests. You do a couple streets that have a high usage, off of Clinton, and you put on every street corner a box of some sort, and you see if people put the needles in it. I know these boxes are expensive. The official biohazard metal box. If there's needles all over the street, I don't want to be sarcastic here, but can't we just put a garbage can? Because they're throwing them right on the street. And just see, as a test, are they going to use the garbage can? If you put 55-gallon garbage cans with a liner on every street corner, just for a month, do they have a tendency, if it's convenient, to put the needles in there? Because it's pretty bad. And this kind of dovetails into safe injection sites, or does it not? Do you want to talk safe injection sites? Yeah, that'd be great. Yeah, so of course I research everything. So I did that harm reduction meeting in New York. I understand the concept of safe injection sites. I have a little warped view of safe injection sites. But again, by the way, everything I'm saying tonight is an opinion. I didn't preface that. And anything I'm also saying is just for general educational purposes and doesn't, have any connection to any former employer or anything. General education. But I look at what I've calculated based on the amount of heroin in use and the population stat. There's probably about 2,500 people in Rochester, in Monroe County, using heroin. 2,500 people. Now, if you have a safe injection site with, maybe 10 places, how many people are going to be using that per day? 100 would be a lot. Now, when they use that, safe injection site is under the premise, will do any harm reduction possible to stop death. Will safe injection sites, even with this nasty fentanyl stuff, stop death? Yes. So if your premise of we have to stop death at any cost, a safe injection site is the answer to stopping death. But it does not reduce crime, because the people are still robbing, stealing, boosting, doing whatever to get the money, to buy the drugs, to use the drugs. In addition, people have to shoot up 3 or 4 times a day, so there tends to be a cluster of people that start developing within a mile or so of the safe injection site, which is, I got to go to the safe injection site, I might as well just hang here, and then the drug dealers come there, and then that whole area becomes a little bit of an issue. How would a safe injection site work, in my opinion? Here's how it would work. You establish a safe injection site. You use a calculation that heroin is 3 times stronger than morphine. You figure out, you ask the person how much heroin they use. You do the rough calculation that they need 10, 20, 50 milligrams of morphine. You give them a syringe with the morphine, and you follow them into the room, and they shoot up the morphine. Now, within 5 minutes, heroin turns into morphine anyways. So you have morphine giving you pretty much that high for the next few hours. And you treat this as an injectable methadone clinic. That's your safe injection site. Then there's no crime. You're not giving them heroin like in England. In England, they give them heroin. It's never going to fly here. But if you're going to give them methadone, and they're going to have it in the orange juice, or you're going to give them morphine in a syringe, and they're going to do that in the site, I think that would work fine. And it would be cheap, because morphine's pretty cheap. So what they used to classify things for mental health is, they said, people would come in and they'd say, okay, they'd ask you a whole bunch of questions. They look it up in the DSM, that manual of disorders, and they'd say you have social anxiety disorder, seasonal affective disorder, general anxiety, panic disorder, a disorder, and then they would give you a medication for the disorder. So what I'm seeing, and from reading and all the stuff that I've been, all the anxiety articles there, it starts, this cascade starts with emotional distress. And they're finally calling it emotional distress. Things are bothering you, and you can't deal with them very well. So you have the anxiety, you have anger, you have the agitation, you have all that stuff, and you're kind of quiet in your room. I'm talking about maybe, younger people they have a lot going on, but that kind of percolates over time into frustration, then it percolates into despair, and then hopelessness, depression, and this is the cascade over time. And then at the depression state, they're not calling it emotional distress anymore, they're calling it a mental health disorder. So my feeling is we have to I always say, we need to get them help before they need the help. How do we realize, and with however busy people are, that they have problems when the parents and the kids don't talk and won't talk? Because back early during the emotional distress part is when, if they said, you know what, it really bothers me when I don't get a good grade and I can't stand it anymore. Well, let's see if we can do something to make that better. That emotional distress before it turns into mental disorder is where we can solve the problem. Because if we deal with that, they don't go to the drugs and alcohol, to deal. When that girl died at the U of R, the 19-year-old freshman microbiology, died a month after Seymour Hoffman. People asked, I cannot believe she would shoot up heroin. And someone said, do you know how expensive this university is? Do you know about the stress that goes on? And that got cut the next day. Because you can't admit that you could use heroin for a coping mechanism. But it's true. It's true. Let's admit that and try to work better on the coping rather than saying, if you have a problem, talk to your counselor. I think we have to use the umbrella of behavioral health and put the mental, emotional health issues and the drug issues all together and work that as a combination for the best cure. Because it's not being done. And everybody says there's not enough money in mental health, and that's absolutely true. But let's work on figuring out what's bothering everybody in maybe school programs and whatever, so that they don't develop the mental health disorders and the suicide and the drug alcohol use. But this has to be together. Mental health is treated separately in a separate division. Drugs are treated separately. It doesn't work. We have to come up together somehow. No, I'm glad you're doing this. I think that I've done a lot of 2-minute news stories, and 2-minute news stories are great for topics, but this is a big issue. It needs a whole bunch of different inputs, not just from people that do rehab, but not just from law enforcement, but from everybody.